several important differences. First of all, for many years, Ukraine had a healthcare model that was inverted compared to the World Health Organization standards. So the system was dominated by hospitals and not so many family doctors. As a result, many people still do not understand the idea that they should first go to a family doctor before seeking a specialist. Of course, we had a huge reform in medical system, but it was like maybe 8 years ago. So actually not so long time ago. And if we think that almost half of this already is war, so people didn't get so much experience of this new system. And still in the minds of lots of generations, the doctor, the real doctor, is a specialist at a hospital. So for people, it may be strange, like, okay, if I go to a family doctor, please send me to a real doctor. So in Ukraine, many family doctors then do not have such equipment as here. So that is why also people understand that, okay, I can get help only in a hospital. So it differs. That is why it is important to explain how the system works. So for me, it was also strange when the family doctor take from your table this dermatoscope, and I thought, oh, wow, you have this here, so I don't have to go to a specialist. Yeah, even going to family doctor in Ukraine, it is having this trusted person. So for example, I have a phone number of our family doctor and the doctor of my daughter. And when I come, she asks all the questions. How is your life? How is it? She's in kindergarten. She tells the stories about her grandson. So a bit different style of communication, as we already discussed. So people, they are not used to come and have, okay, I have this, and that. Yeah. So they're okay, there will be conversation, and then during this conversation, I will share my complaints. So, for example, what we do at Empatia, when people reach out to helpline, we provide people with this a checklist of symptoms, and we help to a person. Okay, if we talk about your emotions, do you feel this or that? Okay, then we can put that you feel that. And we have this checklist in Ukrainian and Dutch, so a person can take and show the doctor that, okay, I have these symptoms. It is important to help people to actually verbalize these symptoms, because people do not really connect that my headache can be actually a symptom of the stress, for example. Okay, so my distraction and my memory problems may be really a symptom that I have stress. So they do not connect this. And it's just important to give more information and to help them. Yeah. And also to give them understanding of the system, that yeah, you have 15 minutes, so please just write down what you want to tell, because people are being lost in new environment, new language, especially when you don't speak language. Yes, so you already feel more vulnerable, and you may be close and you don't know how to share this. So please write down, maybe then put it in a translator. There is also some like systematic mismatch, because Ukrainian patients may expect more quicker diagnostics, more interventions, more prescriptions, because really pharmacy business is a business in Ukraine. You cannot see advertisement of medicine on Dutch TV, for example. In Ukraine, it is constantly. So in minds of many people, good doctor is a doctor who gives you a pill. There is a difference not like only in medical system but in lifestyle. You should understand that the average life expectancy of Ukrainian men is 62 years old, when for Dutch it's 82. So we have more intense life experience, more working hours. People do not have options for prophylactics. So people do tend to get sick more seriously, and they are more cautious about their health. So that is why health issues, they really rise anxiety among people, and not being able to get this help is like a huge problem. But the last one about the difference, and it is very important to understand, is that in Ukraine we have 50% of state medicine and like 50% of private. So it means that you pay by yourself, but you always have an option. If you do not like the way the doctor treats you, you go to the nearest private hospital the same day and you will get second opinion, and you can get the third opinion. And if the first doctor says paracetamol and the second doctor says paracetamol, but the third gives you prescription like for 100 euros, this is a good doctor. Yeah, so he wants to treat me. So you are in the other culture. You feel that, okay, I do not know those people, I do not trust the system, and they do not want to treat me, so they just only give me paracetamol. And you don't have access. So okay, I feel bad, I go to the doctor tells, okay, we will take your blood analysis, and they take it and nothing happens. And then I call to the family doctor and I ask, so what about my analysis? Because in Ukraine, after taking analysis, the next day you will get results on your mail. And you will know everything. You can check Google and so on. Yes, here you know nothing. And she says, yeah, everything okay, bye-bye. Okay, what is okay? What is my level of iron in my blood? Yes, and so on. So people have anxiety. When you have anxiety, you want to control. You can't control. It raises up anxiety. And then it goes to the classical circle. Explain how the system works, help them to get this understanding how to prepare for the consultation. What information should you provide? Give some basic recommendations how you do this. So how are you getting help from Dutch doctors? Share your experience, how it works. So just basic things how it should be done, because look, it really can be a problem with language barrier when the person comes and he can't explain what is going on, and the doctor says, okay, paracetamol is fine. But actually there can be this not understanding, and the person just loses time, precious time. Yes,